Hello, I'm Dr. Adriana Potter, and on today's videos I'm going to show you how to use the TENS unit to do some neuromuscular reeducation for patella tracking. Quite often when you have some weakness on the quads, as well as some tightness on the ITBand and hamstrings, your kneecap starts tracking on the wrong direction, what we call lateral tracking. And it's usually because of the unopposing forces from the weakness on the medial muscles of the quadriceps, also known as the VMO, and the tightness on the ITBand, which is the outside of the leg. Okay, so sometimes when you're not able to engage the quadriceps the right way and make that patella or kneecap tracking up and down, you're gonna have some knee pain and difficulty with doing any exercises that involve weight bearing and bending the knee. So the TENS unit, it can be used when you are increasing the intensity high enough that creates some tetanic contractions, which is a maximum contraction of the muscle, can help you to do some tracking in that. And obviously we want to be able to facilitate a little bit of those muscles during your functional activities. So we're going to show that for you today. So the first thing you need to do is to have a TENS unit, and there is some of them you're able to change some of the settings, and I'm going to share with you the settings that I put on my unit to create the optimal muscle contraction. If you're having difficulty or having more pain doing this exercise with the assistance of the electrical stim, you probably should see a physical therapist to help you with that. And then once you've been instructed properly, you should be able to carry on and doing the exercises at home. Okay, for my unit I have a TENS 7000. That's the one I have it on my website. I recommend it usually for pain management, but I like to use what you have at home for you to do the exercises. If you're not able to change the settings to what I'm suggesting in this video, you as long as you feel like you being able to successfully have that tetanic contraction of your muscles and you having less pain when doing the exercises, ideally no pain at all with more tracking of the kneecap, so you can use the unit that you have at home. And if you are in doubt and not sure if what you have at home will be good, again, you probably should see a physical therapist to help you with that. Okay, alrighty, so with my unit, what I did in here, we had to work on some specific placements. I want to stand up so you guys can see the placement that I have put on my electrodes. Alrighty, so we have it here, the center of the knee, the medial portion of the knee, and the lateral side. The tightness of the IT band, this is the area that you're going to have the issue here, going from the top of the hip all the way down. Because the lateral retinaculum, which is the band in here, is attached to the IT band right in here, that tends to kind of pull the tightness, pull the kneecap that way, and the unopposing force, which is this muscle here from the VMO, not creating that, counter force in there. So what happens? Your knee track, it starts when you quadricep, it pushes laterally, and more important than that is not just having the lateral tracking, but also having pain, right? So if you're having pain, that's a problem, needs to be addressed. If you're having a lateral tracking, right? So I'm gonna see if we can show you here. So you want to do a quadriceps tightness, I'm gonna relax it here. You should see what happened to the kneecap. It's like how much of that tracking is actually a problem. Usually it's based on your symptoms, okay? So you want to try to aim it for the VMO, which is the medial part of here, and that's when you put the electrodes. For my unit in here, you turn slightly on, and I put it on the mode setting, which is going to be the SD1. I'll show you the pictures on the side of the screen. And then we're doing a 60 hertz and a 300 micro pulse, okay? And then we're doing SD1. And now we're gonna try to create a contraction. So I'm starting to feel the tingling. I just turn it on, and then we're gonna crank it up. So this is something that's gonna create a contraction of the muscle, and you're gonna see the muscle start quivering it. There you go, there you go. And now you see how it kind of locks into my knee, and it creates that full extension. and it relaxes. So the SD mode, SD1 on here, it kind of goes in short little bursts, and it had to be tolerable. So I'm doing more like an open chain, so my foot is not touching the ground. So you guys can see I'm balancing on my right, and then doing that contraction in here with the, in here again. So it's gonna pull, there you go, it fully extended. You can see how it really activates my muscles. Hopefully you guys can see it. I'm gonna turn sideways so you can see a little bit more what's happening. Right, there you go. Got that full contraction in there happening. And let it go. So you might want to do, for the exercise, not having a full maximum contraction, you might go decrease a little bit. And we can kind of try to do some of the exercise in here. So probably both legs squatting, so you want to make sure your feet are width apart, and you're just gonna go squatting it down. And with that, like this is trying to make it contracting, so, and they're gonna go up that way. So squat down. So what we're looking for, right, when you're doing this exercise, let's say that when I try to squat those first few degrees of range of motion in here, it kind of hurts on my kneecap hurts. I want to try to put the electrodes and make that contraction happen as I'm doing the exercise, so it's kind of have that counterposing force happening in my quadriceps. So when I feel the tingling coming in, which is now, I'm going to try to squat, because that's trying to pull my muscle immediately. Okay, so I'm going to show you forward again. So you're trying to squat down when the electrodes are feeling an activation of the muscle, and you go up and relax. It goes into waves, and you're trying to do these exercises within the pattern of the SD1 on the 10-7000 unit. Your unit may be slightly different, so if you're able to adjust ramping on or off, or on time or off time, all those things will give you more flexibility. It all depends what kind of unit you have it in there. But all that we're trying to do is kind of create this contraction of the muscle in here to create that opposing force of your ITBand, help your kneecap to track more medially, ideally centrally, right? And ultimately decrease your pain on the early range of motion for your squat in here. Okay, and you can do a variety of exercises. You can just do single leg balance. You don't have to do any bending in the knee, but you can do open chain on the other leg while you're weight bearing on the symptomatic leg, which is the leg that you're having the pain, right? And you can do forward kicks, you can do back kicks, and you can also add the band exercises for this series as well. Now you can do open chain on the involved leg. So now it's going to help you just creating. So make sure that you are activating it. So you feel the electrical stim coming and going as you are doing functional exercises. And this is an open chain for your involved leg. And you can also do some mini squats in here with single leg, like a back lunge, keeping the knee over your feet and feeling the contraction coming and going to facilitate the kneecap to stay. And we're looking for this specific setting and mode that we selected in here to promote that kneecap to be in the right direction and help you with not having the pain with these exercises because of that patella tracking being off. Okay, of course, you know, into my YouTube series you have level 1 for the knee and level 2, so you can do both of these series. Start with the level 1 if you're having a lot of pain, and you can use the electrodes for the whole series exercise for the level 1 knee stabilization exercises. And then once you are pain-free with that, you can move on to the level 2 knee stabilization exercises, and you're using the electrodes again to create this contraction to facilitate that patella tracking in the right direction without creating pain with the exercises. Okay, So let's just go over a couple things that you need to make sure. One is that whenever you're putting your electrodes on and off, make sure the unit is off, okay? If your unit is on, when you're trying to put it off, take it off the electrode pads, what's gonna happen? You're gonna get a big zap on your finger, and it's gonna scare you. It's not gonna hurt, but it's a big no-no. So make sure that you always turn it off before you do any readjustments for the padding, okay? So you wanna make sure that you're getting that contraction, and you might have to play around where you put in the pads. Like, I know exactly where to go for anatomy wise, because this is what I do for a living. For you, that may not be the case. You might have to adjust the pads several times until you feel like that kneecap is tracking better and it is having the results that you're looking for with the exercises that you're trying to accomplish with this facilitation, this neuromuscular reeducation. And if you're having issues, then that means you need to go see a physical therapist to help you with that. Okay, so that's simple, straightforward, sweet video on neuromuscular reeducation for patella tracking. Hopefully you find this useful. Don't forget to subscribe to my channel. Press the bell button for get further notifications. I'm Dr. Adriana Potter, and thank you so much for watching.